Doc, is it rheumatoid arthritis what I'm suffering of? One doctor told me this is psoriatic arthritis. How do doctors know which is which? I'm Dr. Hatem Eleishi, Professor of Rheumatology at Cairo University in Egypt. Stay with us while we answer this question in this video. If you have not subscribed to my channel, please do now. You will watch a lot of videos that will help you with different types of arthritis. There are several symptoms and signs that can help us sort out rheumatoid arthritis from psoriatic arthritis. You don't have to have all those symptoms and signs together. You need to have some of them. We weigh the strength of each of those symptoms and signs in the process of sorting out rheumatoid arthritis from psoriatic arthritis. Number 1, the pattern of joint affection. Rheumatoid arthritis tends to affect the joints of both sides in a symmetrical fashion, unlike psoriatic arthritis that tends to be asymmetrical. This is not a rigid rule though, and exceptions can exist of course, and it's up to the evaluation and assessment of the doctor to what extent he/she can rely on that sign. Number 2, psoriatic arthritis in one of its patterns of joint affection loves to inflame the distal row of the joints of the fingers, and rheumatoid arthritis does not show much interest in that row of joints. If this is the pattern of joint affection in a patient with psoriatic arthritis, it really helps a lot in the differentiation process. Number 3, in 50% of psoriatic arthritis patients, there is not much stiffness of the joints in the morning, unlike rheumatoid arthritis, where morning stiffness is a more recognized symptom. Number 4, sometimes patients with psoriatic arthritis will get what we call sausage digit. This is inflammation of all the tissues of a finger or a toe. The joints and the tendons and even the soft tissues of that finger or that toe in that case are swollen and look like a piece of sausage. This sign, if present, is very much diagnostic or suggestive of psoriatic arthritis. Number 5, having psoriasis of the skin or the nails or the scalp. If you have psoriasis, skin psoriasis for example, it is likely that your arthritis is psoriatic arthritis. But again, this is not a rule. We cannot confidently say that any patient who has psoriasis of the skin and complains of symptoms in the joints that they have to have psoriatic arthritis. They need to be assessed for that, and as I mentioned, the doctor will do that assessment and decide. Number 6, imaging. We can do some imaging studies. We don't mean here plain x-rays in particular. Plain x-rays, of course, can show the different signs of both diseases, but it takes such a long time for those findings of the disease to be shown on the x-ray. Here we mean joint ultrasound and MRIs. We mostly order joint ultrasounds as they are cheaper and the information they offer us is more than enough for making the differentiation. Lastly, sometimes we cannot sort out. Yes, sometimes we cannot sort out if this is rheumatoid arthritis or psoriatic arthritis or a third inflammatory arthritis. Some patients will show us enough symptoms and signs to categorize them as belonging to the autoimmune arthritis family, but not enough symptoms and signs to specifically give them a name of a disease in the autoimmune arthritis family. This entity does exist, and I discuss it with more elaboration and how to manage it in my video titled Undifferentiated Arthritis. I will leave the link in the comments. I hope the info in this video was helpful for you to have more insight into your diagnosis and how your doctor was sorting it out. More videos about psoriatic arthritis are soon to follow. Take care.